Hi, welcome back to Medicare Mondays. Today's session is being pre-recorded. Today, we will be reviewing what to expect in the upcoming annual enrollment period for Medicare. What is Medicare Annual Enrollment Period? Medicare Open Enrollment Period, or OEP, runs from October 15th to December 7th each year. The OEP is sometimes called Annual Enrollment Period. The changes you can make may include joining a new Medicare Advantage plan or a standalone Part D plan, switching from Original Medicare to Medicare Advantage plan, or switching from a Medicare Advantage plan to Original Medicare with or without a Part D plan. The last change you make by December 7th will take effect on January 1st, 2025. If you need help, sit down with a trusted person, a relative or a friend, or the Rhode Island SHIP counselor closest to you. Call for the closest agency, 1-888-884-8721 to find one near you. Review your coverage for 2025. Regardless of how you receive your Medicare coverage, you should consider some of the following: your access to healthcare providers that you want to see, your access to preferred pharmacies, your access to benefits and services you need, the total cost for insurance premiums, deductibles, co-sharing amounts, the quality of customer service you receive. Original Medicare, you can visit www.medicare.gov or read the 2025 Medicare and You Handbook to learn about Medicare benefits for the upcoming year. Medicare Advantage or Part D plans, read your plan's Annual Notice of Change, ANOC, and Evidence of Coverage, EOC. You will get this in the mail by September 30th each year. Considerations when choosing a new Part D drug plan. Ask yourself the following questions before choosing a Part D drug plan. Does the plan cover all of my medications that I take? Does the plan have restrictions on my drugs, i.e. prior authorizations, step therapy, quantity limits? Prior authorizations mean that you must get approval from your Part D plan before the plan will pay for the drug. Step therapy means that your plan requires you to try a cheaper version of the drug before it will cover the more expensive one. And quantity limits restrict the quantity of the drugs you can get per prescription fill, such as 30-day pills or drug X per month. How much will I pay for a monthly premium and an annual deductible? How much will I pay at the pharmacy, copay, co-share for each drug I take? Is the pharmacy in my plan's preferred network? Can I fill my prescription by mail order? If I have retiree coverage, will the Medicare drug plan work with this coverage? Considerations when choosing a new Medicare Advantage plan. Ask yourself the following questions before choosing a Medicare Advantage plan. How much are the premiums? Is there a deductible? What are the co-insurance or co-pay amounts? What is the annual maximum out-of-pocket cost for the plan? This amount may be high, but can help you protect you if you have expensive healthcare costs. What services does the plan cover? Are the doctors and hospitals in my plan's network? What are the rules I have to follow to access healthcare services and my drugs? Does the plan cover additional healthcare benefits that are not covered by Original Medicare? Will this plan affect any additional coverage I may have? What is star rating for Medicare Advantage plans and Part D plans? Star ratings are quality ratings that provide a measure of the plan's performance. Medicare scores Medicare Advantage plans and Part D plans in several categories, including quality of care and customer service. Ratings from 1 to 5 stars, with 5 being the highest. Medicare assigns plans an overall star rating to summarize the plan's performance. Plan ratings change from one year to the next. Medicare reviews plans' performance during the year and releases new star ratings each October. Please note, star ratings of 3 and below may not be offered next year. How to review or change your coverage. You can go on to the Medicare Plan Finder. It is an online tool that helps you look up and compare plans in your area. To access the Medicare Plan Finder, visit www.medicare.gov/plan-compare. You can review your plan coverage that gives you options to search using your account or to continue a search without logging in. To personalize each search requires you to log into your Medicare account or make an account if you do not have one. Once you are logged in, Plan Finders will save your results and you can access them later. The basic search requires your zip code and the type of plans you want to compare. Your search results will not be saved or accessible once you close the page. Once you enter your information, you will be able to compare a list of plans available in your area. Before using Plan Finder, create a list of healthcare professionals you see, drugs you take, and pharmacies that you get your drugs. This will allow you to compare your options. Additionally, when you decide on a plan, you should call 1-800-MEDICARE or use medicare.gov to enroll in that plan. It is helpful for Medicare to have the official enrollment record in case there are any issues. You can also visit our state health insurance program. If you want a one-on-one help reviewing your options or making changes, call your SHIP. SHIPs are funded by the government to provide trusted, unbiased Medicare counseling. Rhode Island's SHIP, you can call them at 1-888-884-8721. Protect yourself from marketing violations and misleading marketing. During Medicare Open Enrollment, health insurance companies try to reach people in various ways, like television commercials, radio ads, events, mailings, phone calls, and texts. The Center for Medicare and Medicaid Services, CMS, has rules for marketing Medicare Advantage plans and Medicare Part D plans. These rules protect Medicare beneficiaries from aggressive or misleading marketing. Plans are allowed to send you mail. They can also email or call you about other health plans and products as long as you are already in the plan, being a plan member and haven't asked them not to call or email. Emails and or direct mailing. Plans are not allowed to call you or visit you in person or market their products without your permission. Plans who call or send emails must provide an opt-out option for people who no longer wish to receive them. Tips to help you avoid marketing violations and misleading marketing. Watch out for people who ask you for your Medicare number, your Social Security number, your bank information, especially before you decide to enroll. Someone can use this information to enroll you in a plan without your permission. Be careful of what they say or how they say they represent Medicare. Plans are never allowed to suggest that they represent or are endorsed by Medicare or any other government agency. They cannot use Medicare name or logo on their marketing materials. Plans send you unsolicited text messages or calls. Plans must provide you with an option to opt out of communications about Medicare products. It must be done annually and in writing. Be careful of pressuring you with time limits to enroll in their plan. You can use the entire open enrollment period to make your decision. You will not receive extra benefits for signing up early for a plan, and you will not lose your Medicare coverage if you do not pick a plan. Be careful of companies offering you gifts to enroll into their plans. Gifts must be given to everyone at an event regardless of their enrollment choice and cannot be worth more than $15. Who can I contact if I have any questions? Well, you can contact the State Health Insurance Program if you have questions about any notices you receive. SHIP counselors can also help you use the Medicare Plan Finder to review your options and pick a plan that meets your needs. You can also contact the Senior Medicare Patrol. Contact your SMP if you experience potential Medicare fraud, waste, or abuse. The SMP representatives can teach you how to protect yourself. Contact information for your local SMP is on the last page of this document. However, Rhode Island's SHIP and SMP number is 1-888-884-8721. You can contact Medicare at 1-800-MEDICARE. Contact Medicare if you want to change your coverage during open enrollment. You can also call Medicare to help finding plans in your area. You can also contact your current Medicare Advantage or your current Medicare Part D plan. Contacting the plan directly if you have questions about its benefits, coverage, or costs. If you need further assistance during Medicare Open Enrollment, contact any one of our community partners listed here. They are Aging Well, Johnston Senior Center, West Bay Community Action, South Kingstown Senior Center, Westerly Senior Center, The Point, East Bay Community Action Agency, the Leon Matthews Senior Center, Progresso Latino, Child and Family Services of Newport County, Edward King House, and of course, the state Rhode Island SHIP and SMP line. Thank you for attending, and feel free to contact us if you have any questions. 1-888-884-8721. My name is Kim Timpson. I'm the Health Insurance Coordinator for the state of Rhode Island, and Jennifer Riaz is the SHIP and SMP Volunteer Coordinator for the state of Rhode Island under SHIP.